A sugar substitute is a food additive that duplicates the effect of sugar in taste, usually with less food energy. Some sugar substitutes are natural and some are synthetic. Those that are not natural are, in general, called artificial sweeteners. An important class of sugar substitutes is known as high-intensity sweeteners. These are compounds with many times the sweetness of sucrose, common table sugar. As a result, much less sweetener is required and energy contribution is often negligible. The sensation of sweetness caused by these compounds is sometimes notably different from sucrose, so they are often used in complex mixtures that achieve the most natural sweet sensation. If the sucrose that is replaced has contributed to the texture of the product, then a bulking agent is often also needed. This may be seen in soft drinks or sweet tea that are labeled as diet, or light that contain artificial sweeteners and often have notably different mouthfeel, or in table sugar replacements that mix maltodextrins with an intense sweetener to achieve satisfactory texture sensation. In the United States, 6 intensely sweet sugar substitutes have been approved for use. They are stevia, aspartame, sucralose, neotame, acesulfame potassium, and saccharin. There is some ongoing controversy over whether artificial sweetener usage poses health risks. The U.S. Food and Drug Administration regulates artificial sweeteners as food additives. Food additives must be approved by the FDA, which publishes a generally recognized as safe list of additives. To date, the FDA has not been presented with scientific information that would support a change in conclusions about the safety of these approved high-intensity sweeteners. The safe conclusions are based on a detailed review of a large body of information, including hundreds of toxicological and clinical studies. The majority of sugar substitutes approved for food use are artificially synthesized compounds. However, some bulk natural sugar substitutes are known, including sorbitol and xylitol, which are found in berries, fruit, vegetables, and mushrooms. It is not commercially viable to extract these products from fruits and vegetables, so they are produced by catalytic hydrogenation of the appropriate reducing sugar. For example, xylose is converted to xylitol, lactose to lactitol, and glucose to sorbitol. Other natural substitutes are known but are yet to gain official approval for food use. Some non-sugar sweeteners are polyols, also known as sugar alcohols. These are, in general, less sweet than sucrose but have similar bulk properties and can be used in a wide range of food products. Sometimes the sweetness profile is fine-tuned by mixing with high-intensity sweeteners. As with all food products, the development of a formulation to replace sucrose is a complex proprietary process. Reasons for use: sugar substitutes are used for a number of reasons, including, to assist in weight loss. Some people choose to limit their food energy intake by replacing high-energy sugar or corn syrup with other sweeteners having little or no food energy. This allows them to eat the same foods they normally would while allowing them to lose weight and avoid other problems associated with excessive caloric intake. Dental care. Sugar substitutes are tooth-friendly, as they are not fermented by the microflora of the dental plaque. An example of a sweetener that can benefit dental health is xylitol. Xylitol works to prevent bacteria from adhering to the tooth surface, thus preventing plaque formation and eventually decay. The carbohydrates and sugars consumed usually adheres to the tooth enamel. Bacteria can feed upon this food source, allowing them to quickly multiply. As the bacteria feed upon the sugar, they convert it to acid waste that in turn decays the tooth structure. Xylitol cannot be fermented by these bacteria, so the bacteria have difficulty thriving, thus helping to prevent plaque formation. Diabetes mellitus. People with diabetes have difficulty regulating their blood sugar levels. By limiting their sugar intake with artificial sweeteners, they can enjoy a varied diet while closely controlling their sugar intake. Also, some sugar substitutes do release energy but are metabolized more slowly, potentially allowing blood sugar levels to remain more stable over time. Reactive hypoglycemia. Individuals with reactive hypoglycemia will produce an excess of insulin after quickly absorbing glucose into the bloodstream. This causes their blood glucose levels to fall below the amount needed for proper body and brain function. As a result, like diabetics, they must avoid intake of high glycemic foods like white bread, and often choose artificial sweeteners as an alternative. Avoiding processed foods. Individuals may opt to substitute refined white sugar with less processed sugars, such as fruit juice or maple syrup. Cost. Many sugar substitutes are cheaper than sugar. Alternative sweeteners are often low in cost because of their long shelf life and high sweetening intensity. This allows alternative sweeteners to be used in products that will not perish after a short period of time. Health issues, weight gain and insulin response to artificial sweeteners. Animal studies have indicated that a sweet taste induces an insulin response in rats. However, the extension of animal model findings to humans is unclear, as human studies of intragastric infusion of sucralose have shown no insulin response from analogous taste receptors. The release of insulin causes blood sugar to be stored in tissues. In the case of a response to artificial sweeteners, because blood sugar does not increase, there can be increased hypoglycemia or hyperinsulinemia and increased food intake the next time there is a meal. Rats given sweeteners have steadily increased calorie intake, increased body weight, and increased adiposity. Furthermore, the natural responses to eating sugary foods are gradually lost. A 2005 study by the University of Texas Health Science Center at San Antonio showed that increased weight gain and obesity were associated with increased use of diet soda in a population-based study. The study did not establish whether increased weight gain leads to increased consumption of diet drinks or whether consumption of diet drinks could have an effect on weight gain. A 2012 study at Universidad Federal do Rio Grande do Sul showed that addition of either saccharin or aspartame to the diet of test rats resulted in increased weight gain compared to addition of sucrose, when total caloric intake was similar among groups. Food industry usage of artificial sweeteners. The food and beverage industry is increasingly replacing sugar or corn syrup with artificial sweeteners in a range of products traditionally containing sugar. According to market analysts Mintel, a total of 3,920 products containing artificial sweeteners were launched in the U.S. between 2000 and 2005. In 2004 alone, 1,649 artificially sweetened products were launched. According to market analysts Freedonia, the United States artificial sweetener market is set to grow at around 8% per year to $189 million in 2012. Aspartame is currently the most popular artificial sweetener in the U.S. food industry, as the price has dropped significantly since the Monsanto company patent expired in 1992. However, sucralose may soon replace it, as alternative processes to Tate and Lyle's patent seem to be emerging. According to Morgan Stanley, this can mean that the price of sucralose will drop by 30%. Alternative sweeteners are highly consumed in America. According to research studies explained by the American Journal of Clinical Nutrition, in 2003–2004, Americans 2 years of age and older consume 585 g per day of beverages and 375 g per day of foods with caloric sweeteners. More than 66% of Americans consumed these beverages with alternative sweeteners and 82.3% of Americans consumed foods with added caloric sweeteners. On the other hand, 10.8% of Americans in 2003–2004 consumed non-caloric alternative sweetener-flavored beverages and 5.8% consumed non-caloric alternative sweetener-flavored foods. Some commonly consumed foods with alternative sweeteners are diet sodas, cereals, and sugar-free desserts such as ice cream. Alternative sweeteners are found in many products today due to their low or non-caloric characteristics. This can be used as a method of advertisement for dieters or those conscious of their sugar intake. Those with diabetes can greatly benefit from alternative sweeteners that do not affect their blood sugar levels drastically. This aids in maintaining low insulin use in the body and blood sugar levels. Alternative sweeteners such as xylitol and saccharin have many positive research results that show qualities of dental decay prevention. Sugar substitutes commonly used in food. Aspartame. Aspartame was discovered in 1965 by James M. Schlatter at the G.D. Searle Company. He was working on an anti-ulcer drug and accidentally spilled some aspartame on his hand, When he licked his finger, he noticed that it had a sweet taste. It is an odorless, white crystalline powder that is derived from the two amino acids aspartic acid and phenylalanine. It is about 200 times as sweet as sugar and can be used as a tabletop sweetener or in frozen desserts, gelatins, beverages, and chewing gum. When cooked or stored at high temperatures, aspartame breaks down into its constituent amino acids. This makes aspartame undesirable as a baking sweetener. It is more stable in somewhat acidic conditions, such as in soft drinks. Though it does not have a bitter aftertaste like saccharin, it may not taste exactly like sugar. When eaten, aspartame is metabolized into its original amino acids. Because it is so intensely sweet, relatively little of it is needed to sweeten a food product, and is thus useful for reducing the number of calories in a product. The safety of aspartame has been studied extensively since its discovery with research that includes animal studies, clinical and epidemiological research, and post-marketing surveillance, with aspartame being one of the most rigorously tested food ingredients to date. Aspartame has been subject to multiple claims against its safety, including supposed links to cancer as well as complaints of neurological or psychiatric side effects. Multiple peer-reviewed comprehensive review articles and independent reviews by governmental regulatory bodies have analyzed the published research on the safety of aspartame and have found aspartame is safe for consumption at current levels. Aspartame has been deemed safe for human consumption by over 100 regulatory agencies in their respective countries, including the UK Food Standards Agency, the European Food Safety Authority and Canada's Health Canada. Cyclamate. In the United States, the Food and Drug Administration U.S. Food and Drug Administration banned the sale of cyclamate in 1970 after lab tests in rats involving a 10-1 mixture of cyclamate and saccharin indicated that large amounts of cyclamates causes bladder cancer, a disease to which rats are particularly susceptible. Cyclamates are still used as sweeteners in many parts of the world, including Europe. Saccharin. Aside from sugar of lead, saccharin was the first artificial sweetener and was originally synthesized in 1879 by Remsen and Feilberg. Its sweet taste was discovered by accident. It had been created in an experiment with toluene derivatives. A process for the creation of saccharin from phthalic anhydride was developed in 1950, and, currently, saccharin is created by this process as well as the original process by which it was discovered. It is 300 to 500 times as sweet as sugar and is often used to improve the taste of toothpastes, dietary foods, and dietary beverages. The bitter aftertaste of saccharin is often minimized by blending it with other sweeteners. Fear about saccharin increased when a 1960 study showed that high levels of saccharin may cause bladder cancer in laboratory rats. In 1977, Canada banned saccharin due to the animal research. In the United States, the FDA considered banning saccharin in 1977, but Congress stepped in and placed a moratorium on such a ban. The moratorium required a warning label and also mandated further study of saccharin's safety. Subsequent to this, it was discovered that saccharin causes cancer in male rats by a mechanism not found in humans. At high doses, saccharin causes a precipitate to form in rat urine. This precipitate damages the cells lining the bladder and a tumor forms when the cells regenerate. According to the International Agency for Research on Cancer, part of the World Health Organization, saccharin and its salts was downgraded from Group 2B, possibly carcinogenic to humans, to Group 3, not classifiable as to carcinogenicity to humans, despite sufficient evidence of carcinogenicity to animals, because it is carcinogenic by a non-DNA reactive mechanism that is not relevant to humans because of critical interspecies differences in urine composition. In 2001 the United States repealed the warning label requirement, while the threat of an FDA ban had already been lifted in 1991. Most other countries also permit saccharin but restrict the levels of use, while other countries have outright banned it. The EPA has officially removed saccharin and its salts from their list of hazardous constituents and commercial chemical products. In a December 14, 2010, release the EPA stated that saccharin is no longer considered a potential hazard to human health. Stevia. Stevia has been widely used as a natural sweetener in South America for centuries and in Japan since 1970. Due to its unique characteristics of zero glycemic index and zero calories, it is fast becoming popular in many other countries. In 1987, the FDA issued a ban on stevia because it had not been approved as a food additive. After being repeatedly provided with a significant amount of scientific data proving that there was no side effect of using stevia as a sweetener from companies such as Cargill and Coca-Cola, the FDA gave a no objection approval for GRAS status in December 2008 to Truvia, a blend of Rebiana and erythritol, as well as Purevia, both of which using Rebordioside A derived from the stevia plant. In Australia, the brand Vitarium have used Notvia, a natural stevia sweetener, to do a range on sugar-free children's milk mixes. Sucralose. Sucralose is a chlorinated sugar that is about 600 times as sweet as sugar. It is produced from sucrose when 3 chlorine atoms replace 3 hydroxyl groups. It is used in beverages, frozen desserts, chewing gum, baked goods, and other foods. Unlike other artificial sweeteners, it is stable when heated and can therefore be used in baked and fried goods. About 15% of sucralose is absorbed by the body and most of it passes out of the body unchanged. The FDA approved sucralose in 1998. Most of the controversy surrounding Splenda, a sucralose sweetener, is focused not on safety but on its marketing. It has been marketed with the slogan, "Splenda is made from sugar, so it tastes like sugar." Sucralose is prepared from either of 2 sugars, sucrose or raffinose. With either base sugar, processing replaces 3 oxygen-hydrogen groups in the sugar molecule with 3 chlorine atoms. The Truth About Splenda website was created in 2005 by the Sugar Association, an organization representing sugar beet and sugarcane farmers in the United States, to provide its view of sucralose. In December 2004, 5 separate false advertising claims were filed by the Sugar Association against Splenda manufacturers Mrecent and McNeil Nutritionals for claims made about Splenda related to the slogan, "Made from sugar, so it tastes like sugar." French courts ordered the slogan to no longer be used in France, while in the U.S. the case came to an undisclosed settlement during the trial. There are few safety concerns pertaining to sucralose, and the way sucralose is metabolized suggests a reduced risk of toxicity. For example, sucralose is extremely insoluble in fat and, thus, does not accumulate in fatty tissues. Sucralose also does not break down and will dechlorinate only under conditions that are not found during regular digestion. Lead acetate. Lead acetate is an artificial sugar substitute made from lead that is of historical interest because of its widespread use in the past, such as by ancient Romans. The use of lead acetate as a sweetener eventually produced lead poisoning in any individual ingesting it habitually. Lead acetate was abandoned as a food additive throughout most of the world after the high toxicity of lead compounds became apparent. Mogrosides. More recently, mogrosides have been used in commercial products after the FDA granted some of the compounds GRAS status in 2010. As of 2011, it is not a permitted sweetener in the EU, although it is allowed as a natural flavor at concentrations where it does not function as a sweetener. Some of the products incorporating it are Nestlé copyright S. Milo in Asia and certain Kellogg cereals in the US. It is also the basis of McNeil Nutritionals' tabletop sweetener Nectress in the US and Norber's sweetener in Australia. As of 2012, the New Zealand company BioVitoria provides more than 90% of the global supply of monk fruit extract. Its main manufacturing facility for the product is in Guilin, China. List of sugar substitutes and their sweetness relative to sucrose. The 3 primary compounds used as sugar substitutes in the United States are saccharin, aspartame and sucralose. Maltitol and sorbitol are often used, frequently in toothpaste, mouthwash, and in foods such as no-sugar-added ice cream. Erythritol is gaining momentum as a replacement for these other sugar alcohols in foods as it is much less likely to produce gastrointestinal distress when consumed in large amounts. In many other countries, xylitol, cyclamate, and the herbal sweetener stevia are used extensively. Natural sugar substitutes. The sweetnesses and energy densities are in comparison to those of sucrose. Artificial sugar substitutes. Comparison of sweetness based on energy content is not meaningful because many artificial sweeteners have little or no food energy. See also, List of unrefined sweeteners, milk substitute, references. Further reading, Eric D. Walters, Frank T. Author, Grant E. Dubois. Sweetness: A Discovery, Molecular Design, and Schema Reception are developed from a symposium sponsored by the Division of Agricultural and Food Chemistry at the 199th National Meeting of the American Chemical Society, Boston, Massachusetts, April 22, 27, 1990 inches. Food/Narong 35, 1046. doi, 10.1002/food 19,910,351,011. ISBN A978-0-8412-1903-8. External links, Calorie Control Council, Euro Trade Association for Manufacturers of Artificial Sweeteners and Products.